This is the Jedburgh podcast. I'm the host, Fran Racioppi. Each episode, I speak with transformative leaders, visionaries, drivers of change, and those dedicated to winning, no matter the challenge. The Jedburgh podcast is founded in the lineage of the Special Operations Jedburgh teams of the past and is sponsored by Talent War Group, an executive search and talent advisory. Visit talentwargroup.com for more. A percentage of all proceeds is dedicated to the Special Operations Warrior Foundation. Resilience is defined as an ability to recover from or adjust easily to misfortune or change. Adaptability is the quality of being able to adjust to new conditions. As leaders and as people, we are defined by what we do after the misfortune, after the change, or how we adjust to the new conditions. Events that can often happen in the blink of an eye. Richard Hanbury is the founder and CEO of Sana Health, a set of wearable glasses that use coordinated pulses of light and sound to reduce chronic pain and fatigue by guiding a user into a state of relaxation and training your body and mind to overcome pain. Richard founded the company to save his own life after he was forced to drive his car off a bridge in Yemen. He was 19 and he lost the use of his legs. Richard developed Sana as a long-term solution to the root causes of pain and as an alternative to opioids, which only mask the pain and cause untold adverse effects on patients. Today, Sana has won numerous medical industry awards, including the MedTech Innovator Award, the Under Armour Innovation Award, the Bear Self-Care winner, and the Mount Sinai Rehab Competition. Richard joins me on this episode to tell his story of resilience, adaptability, innovation, and his mission to save not only his own life, but the lives of all those suffering from chronic pain and opioid addiction. Richard also shares the three most profound daily foundations of success that we've heard on the podcast to date. Richard, welcome to the Jedburgh podcast.
Good morning. It's a pleasure to be here.
They say your life can change in a second. You can have everything and you can lose it all. You could have nothing and then you could have it all. You can be healthy and strong, and in an instant, you can be paralyzed or even dead. Sometimes it's our own fault. Many times it's not. I was telling you before we started that I'm actually at Boston University today, and I'm reminded of Travis Roy, who was a hockey player here in 1995, and 11 seconds into his very first game, he fell to the ice and he broke his neck and was paralyzed. Is a story that impacted not only him and his family, but the whole BU community. And still today, the BU talks about it at length. But it's what we do after the change that defines us. It's how we pick ourselves up, dust ourselves off, refocus. We talk on the podcast about the 9 characteristics of elite performance. But of these 9, it's resiliency, followed closely by our adaptability, that defines who we are after these instances. Richard, you were 19 when your life changed. You technically died. You lost the use of your legs. But here you are, very much alive, sitting with me today. And you've now won the MedTech Innovator Award, the Under Armour Innovation Award, the Bear Self-Care winner, the Mount Sinai Rehab Competition winner, and so many others that I don't even have time to list them. You've developed a product that saved your life and now is saving many others from chronic pain, depression, anxiety, and suicide. I'm honored to sit here with you today, tell your story, tell the story of Sana, and tell this story of resiliency and adaptability. So thank you.
My pleasure. Thank you for having me.
Let's start at the top. In 1992, you were forced to crash your Jeep off a bridge in Yemen. You were pronounced clinically dead for 8 minutes and then in a coma for 6 weeks. You spent the next 14 months in the hospital. What happened?
The actual accident itself, I was traveling in the Yemen. I was actually a student, but every time I worked with any people from your previous line of work, they were like winking at me going, sure you were, but no, I really was a student. Arabic was my undergraduate degree.
No one goes to Yemen normally unless you're associated with some sort of special operations.
Exactly, but we were actually living in Egypt, but at the time everyone in Egypt wanted to learn English. So you'd be in a taxi and the taxi driver would just know how to say hello, and he'd spend 20 minutes practicing how to say hello rather than say anything to you in Arabic. And so off we went to the Yemen to have it was the only place that would give us a visa on short notice when my roommate's girlfriend, he split up with her, so we didn't have the place that we were supposed to be going skiing. So luckily for me, fitness-wise, I trained to be going racing, skiing for 6 weeks, which was another one of the tiny little pieces of stuff that had it not happened, I wouldn't have made it through. But I'd been running up and down a 10-story building with a rucksack full of books to get fit for that. And so when I had my accident and later in the Yemen, I was in the best physical shape of my life. But on the actual accident itself, it was something that could have been a drink driving accident here. But in the Yemen, about 80% of the men chew a drug called GAT every day. But we were just at the end of the Civil War, so there was no guidebook saying, hey, don't drive in the middle of the afternoon because everyone's high. But I was driving down a road, and then I was level with a petrol truck coming in the opposite direction. And when I was level with the front of it, a car pulled out from behind. So in that split second, I had to make a choice of head-on collision next to a petrol truck or go off a bridge. In that split second, I had this image of my dad wandering around the country trying to find remains. And I figured that we were dead either way, but at least if I went off the bridge, there'd be something left to find. And then as we were hitting the side of the bridge, the second thought was, oh yeah, no, we won't kill the person who's caused this. That wasn't the reason why I started heading for the side of the bridge. My dad was. But yeah, 60 foot down into dry riverbed, Jeep crumpled up like a Coke can. And my passenger broke a lot more bones than I did. Cracked thigh bone, cracked arm broken in 3 places, collar blade, shoulder bone. And he was responsible for getting me out of the Jeep. And he said the moment that I started screaming was simultaneously the best and worst sound he'd ever heard in his life. But he was responsible for getting me out of the country. He was bringing me food, even in that shape, he was bringing me food and water into the so-called hospital in Yemen because the hospital didn't have any food, didn't have any water.
I mean, they came and rescued you, right? The Yemenis came and had to take you to their hospital.
Yeah, he got people who were followed by the side of the road to come help. Or they started running. I was unconscious, and luckily he was the one who became conscious first because his Arabic was good enough in an emergency to shout, danger, petrol, cigarettes. And they threw them away. If it had been me, I'm not sure my Arabic was good enough at that point, and I think the story would have ended right there in a cloud of smoke because everything was covered in petrol. But yeah, they got us back to the so-called hospital. There was no food or water or drugs in the hospital. There was a Russian orderly, no fax machine. The insurance company said they wouldn't send a plane unless there was a fax from a doctor. And yeah, my friend basically said, if you don't send a plane, I'm going to spend the rest of my life, I'm going to make it my mission to destroy your insurance company. So send a plane. And they said, okay, we'll send a plane as long as you pay for it if it's not needed. So he did all of that. He was responsible for getting me out of the country. So the medevac plane came, picked me up, took me back to Southampton Hospital in the UK. And that was the worst bit of it.
I mean, these places are tough. You know, I mean, like I think about my time in Africa and the Middle East, and you go and you visit these hospitals, and I mean, you're absolutely right. There's nothing there, and it's in the back of your mind that the last place I want to be is in a hospital in this country.
Yeah, I wasn't smart enough or wise enough to think about that at that point in time. If I had been, I don't think we would have been there. But yeah, and then I'll never say a bad word again about the National Health Service in the UK, especially having dealt with the American healthcare system. There's just so much in the UK that we take for granted about how the National Health Service actually looks after us. And yes, it's not a perfect system, but yeah, I've recently been had an episode with the US system and having to fight insurance companies to make sure they didn't do what the doctor said would kill me. So the doctor's saying, you can't go home until this point, and if you do, you will probably die. And the insurance company goes, no, you got to go home right now. And like that kind of stuff never happens in the UK. I mean, it blew my mind. And luckily, I'm used to fighting that kind of argument and got the lawyers involved and stopped the insurance company from killing me. But yeah, I mean, it's one of those things as a Brit that the NHS really is something that we take for granted every day, mostly.
What were the extent of the injuries?
So I had a traumatic brain injury. I had a spinal cord injury from T8 to T10, so belly button level, 3 vertebrae that were basically just impact fractured. So, imagine the weight of a Jeep falling 60 foot. My spine took most of that impact. And then I had an aortic tear, which would normally kill people in under 30 seconds. And that was what nearly killed me. What made me clinically dead for 8 minutes when I was back in the UK. Because I bled internally and I lost 40% of my body weight during that 4 days it took from the accident to when I was back in the UK. And broken collarbone, which was insult to injury, because when I was lying in bed, I was like, my collarbone is hurting. And they were like, no, it's not. I was like, yes, it is. It must be broken. They're like, no, it's not. And I'm like, it is. And then eventually, when I was able to touch it, when I was able to move my arm enough to actually put my hand up there, I was like, I can feel the bump. It was broken. Why did you tell me it wasn't? And they were like, well, you had to lie on it anyway, so we didn't want to. And I was like, I just wanted you to acknowledge my experience. If you told me, hey, yeah, sorry, we know it's broken, but you have to lie on it anyway because otherwise you'll die, I would have shut up. But yeah, they wouldn't. It was a good lesson about, even if it's uncomfortable, acknowledging someone's experience is actually really helpful anyway.
The doctors gave you 5 years to live, citing the extreme chronic nerve damage and the pain that was associated with that. Can you talk a bit more about the extent of the pain and why would they tell you that because of the pain, you have a 5-year life expectancy?
Yeah, basically, if you think about the spectrum between fight, flight, and rest recovery, we all move up and down that spectrum every day. But the more that you're in chronic fight, flight, chronic stress from whatever it is in your life, the shorter your life expectancy, the more problems you have. A good example of this is something like fibromyalgia, where most people at some stage have PTSD or undiagnosed PTSD, so some trauma. So, and there's an example where you get set on a more edgy fight flight. So you're not getting as much rest recovery. Extreme chronic pain is the extreme of that. So the whole time your body is in fight flight, so nothing recovers. And then sooner or later something breaks. So Christopher Reeve is one of the best known people with spinal cord injuries with that level of nerve damage pain. And usually with his level of injuries, it's either lung issues or it is pressure injuries that is the thing that breaks, that finally gets you. With my level of injury, it's usually pressure injuries. So yeah, it was. They told me that after about 6 months of going through the entire standard of care, and there have been some improvements in some of the treatments since then, but really not a lot. It's an area where there hasn't been many advances.
At that 6-month mark, were you mobile at that time? I mean, what was your condition?
That's a good point. So it must have been more like 9 or 12 months, because the first 6 months I was still in bed. So it's 14 months total in hospital. They took a while before they could stabilize my spine because I wasn't in good enough shape because of the aortic tear. So fixing the aortic tear was the first priority when I was in hospital. And then they took a while before they could stabilize the rest of my back and then get me out. But yeah, and it was a stabbing pain that just was almost 24 hours a day. I mean, when I was sleeping, the majority of the time I was sleeping, I was lucidly aware in my dreams how much pain I was in. And I was getting almost no deep sleep. And the only way I could get that stabbing pain to become a constant pain was lying doubled up with my arm across my belly, my break area, and then lying on top of that with my head over my ankles. So basically squashing myself up like a pretzel was the only way that I could apply enough pressure to get the stabbing pain into a constant pain, which then allowed me to get some sleep. So realistically, I did think about this at the time. I had no reason why I would have withstood 5 years. I would have got out of hospital. I would have said my goodbyes. I would have found a way to exit stage left, because at that point, I didn't have a family. I didn't have my own family. I had my dad, my mum, my stepmom, my sister, but I didn't have a kid that I was responsible for. So yeah, had I not got my lucky break in hospital, yeah, I probably wouldn't have got it outside hospital.
Well, let's talk about the lucky break. You called it your light bulb moment, and you said it happened while you were watching a film in the hospital, and that it was a Bruce Willis film. And you've credited Bruce Willis with saving your life. And I laugh because, I mean, Bruce Willis has saved a lot of people's lives. He is John McClane.
Indeed.
How did he save yours?
So it was Hudson Hawk was the movie. By that stage, the hospital had tried to, even back then, get me to learn some meditation and mindfulness to reduce pain. It's a really bad idea if you're in constant pain or constant anxiety to try and learn meditation, because all it does is make you more present moment aware of how much pain you're in. If there are people who it has worked for in that state, I'd love to hear from them because I haven't heard anybody say that. What typically works is if you're in episodic pain or anxiety and you're having a good day and then you do some meditation, then you can expand those good days. For me, that had really failed. And then watching that movie, what it did was, because the movie had bits that for me were really funny, fast-paced, engaging when they were singing songs as they're burglarizing museums, that would put me into what we would now call a flow state. The bits in between where the dialogue goes really bizarre and obscure in places was, from my experience, a bit like watching adverts in the middle of your favorite show. You're engaged and then you're not. You're engaged and then you're not. And by the end of the movie, my thought was, holy crap, that changed my pain levels more than morphine. And the bits of the movie that made me feel less pain made me feel like I used to when I was skiing. And then that kind of led down the train of thought to, well, so if I had meditated all my life up until this point, I would be able to access these states at will. And that would be pretty useful right now. That would be a good painkiller right now. And that then led to the train of thought of, okay, well, if I had meditated all my life, how would my brain be different? And it turns out that with meditation, there are really two different classes of benefit. There is a whole bunch of wisdom, self-knowledge, self-growth stuff that happens that you can speed up by getting the right teachers, doing the right type of meditation for you, doing more practice. You can speed it up, but you can't really shortcut it. And then the other side of the equation is how it changes the frequency distribution pattern in your brain, how the electrics work, what frequency your brain operates on. And that, it turns out that you really can shortcut. And that's what we ended up doing.
I find this fascinating because you were not a doctor. And in fact, you studied history, languages, politics, Arabic, Middle Eastern studies. It's like all the reasons why I studied journalism. So I didn't have to do math, and I didn't have to take any of the chemistry courses. But here you are. I mean, in the hospital, and you're kind of faced with this position of like, I have to save my own life. If I'm going to get out of this situation, it's not going to be because of these doctors who understand this. It's going to be because of me and my ability to figure it out. You said that the process of sauna, and I want to get in to start talking about sauna here, that the process works by entrainment. And entrainment is when the brain senses a speed and a pattern in incoming signals and adopts them. The sauna device uses an audiovisual stimulation to increase the balance between the left and right sides of your brain, guiding you into the state of deep relaxation that you talked about that you could achieve through some meditation. I have a question about the product and the 16-minute piece of it. And so if you would maybe talk a little bit more about the design of the product, what it's actually doing, how it's putting you into this meditative state, and then how come it's 16 minutes?
Okay, yeah. So lots of questions in that one. So
yeah, I threw a lot at you, I know.
Yeah. So the doctor bit of it, not being a medic. In my high school years at school, biology, chemistry, maths were my three topics, and my biology teacher happened to be one of the world's top experts on the neurobiology of memory and nerves. And he was supposed to teach us about a whole bunch of stuff about plants and the rest of the human body. But day one of that class, he was like, I'm an expert in nerves. I'm going to teach you about nerves and the brain, because the brain is the most interesting part. And if you want to go and learn about other stuff, there are plenty of other biology teachers in the school who will take you. No one left that class. Out of 18 of us, I think 14 ended up doing lifelong stuff to do with brain stuff in one form or another. And so I was really lucky that I had some basis before I went into all of this. And then in hospital, there were two things that happened. One is once I started asking the meditation question, I started reading up, well, like what research has been done. And I rested on the shoulders of some amazing, amazing research that was done by lots of people, but in particular, a guy called Maxwell Cade, who wrote a book called The Awakened Mind. And he basically worked out that the longer people meditated, the more they ended up with what he termed as hemispheric balance. So the two sides of the brain between 1 and 30 hertz, when looked at for people doing a basket of cognitive functions. So if you just do one cognitive function, you could be daydreaming, which is a mostly right brain activity for right-handed people, or you could be doing logic and maths, which for right-handed people again would be more of a left brain activity. These are all real gross simplifications of what's happening. But he worked out, hey, if we do people on a standardized protocol, we look through all these different little bits. The longer people meditate, the more on my protocol they end up with their brain producing the same amount of activity on both sides. And reading all of that made me go, okay, so there is a way in which I could potentially have a roadmap here. I can buy the same gear he did. I can look at my brain compared to the long-term meditators, and that will give me a roadmap. So we're talking Windows 95 laptops at this point, and a 2-channel EEG that I bought and had shipped to me from Holland. And so that was that part of it. And the other side of it was, as a 15-year-old, I was kind of a typical 15-year-old in that I wanted to do less work, but I was also determined to get the same grades. So the question was always, how can I do less work and still get the grades I want?
This sounds like efficiency right there.
Yeah, exactly. So where most of my classmates were lying by the pool in the summer before exams, like trying to work and lie by the pool at the same time, I was up at 5 a.m. working, and I hate getting up early, working for 2 hours solidly in my room, and then actually goofing by the pool for the rest of the day rather than trying to do both at the same time, which doesn't work. And so it was all about efficiency. But I subscribed to this journal that was about learning and memory. It was a really obscure academic journal. And in there, during this period where I was just coming out of hospital, I read this report about this guy who was teaching corporate clients to speed read. And he was using pulsed light to improve how they were reading. And my brain just goes, hang on a minute, but skiing is speed reading. Skiing is taking everything from your environment and your body and processing that information super quickly. So it's like, okay, well, if I can get that and I can get the EEG meditation stuff and somehow actually put the two together, then maybe I can end up with something that's gonna help me. And yeah, it did. I mean, the EEG gave me my brain was in a massive imbalance, and then the visual stimulus and then audio stimulus, and working out how to sequence that. It was a very large amount of trial and error. And because I was in so much pain, any slight improvement in that algorithm, I felt, and then I went to look on the EEG whether it was backing up what I was feeling. And my pain sensitivity was more than the EEG at that point. So that's how all that bit came together. And it didn't, so the first day that I had 2 minutes of being pain-free after using the device rather than just during was the day we created something, like the day that I sort of stumbled on something that was more than distraction. So right now, for example, VR. So virtual reality is used in some ways that are just distraction, show someone a really engaging scene, and does it lower their pain temporarily? And the answer is yes, it does. And there are more sophisticated things that are now done with using that technology with cognitive behavioral therapy to change the way people think, which has longer term benefits. But that day, when I got those first 2 minutes of being pain-free after using it, I was like, ooh, okay. And I now did what we would now call the design freeze. And I thought, okay, I'm just going to do this for a bit and see what happens. And then 3 months later, I got up to 24 hours of that pain, and that was the last day. That was October 30th, 93. That was the first day that I had 24 hours pain free. And I was a bit like, I've spoken to some people who are cancer survivors, and I had some of the same not wanting to believe that it was okay and being scared of believing that it still wasn't going to kill me and that it was going to come back. And at that point, I thought, you know what? I'm going to write a note. I'm going to write a note in my diary for 6 months' time. And if I hit that in the 6-month note without pain, I'm just going to acknowledge that it's fixed and it's not coming back and I'm okay. And that period of time I didn't allow myself to start thinking, how can I help anybody else with this? Because I wasn't allowing myself to be convinced that I'd help myself. Got to that 6-month note in the diary. Oh, hit 6 months. Does really appear that I have to admit that this is gone and I don't have to worry about it anymore. Cool. Who else can I help with this? And then that led into the first person I helped with panic attacks, who I begged not to tell anybody. I was like, look, I don't know what I'm doing. You're asking me to help you. I'll try and help you, but I'm really making this stuff up as I go along. Please don't tell anybody. He promised, and then promptly went and told 3 girls, all who had PTSD from rape. And that was a hardcore entry into, oh crap, there are plenty of other people with really, really big problems that maybe. And the first person I actually refused to help because I was like, this is you're asking me to do something which is way over the realm into doing things that I am not trained or licensed or have any training whatsoever to do. And her response to me was pretty brutal. Her response was, my therapist I get flashbacks every time I go and see my therapist because I end up reliving my trauma and it makes it worse. My priest makes me feel guilty about being raped, and so I can't go to him anymore. The drugs that I was given made me suicidal, or maybe more suicidal. And yeah, so she basically said to me, in that first meeting, she said, your worst case scenario is that I commit suicide slightly faster than I might otherwise have done it. Your best case scenario is you stop me wanting to commit suicide. She says, I'm not suicidal right now, but it comes and goes in waves, and sooner or later it'll come back. And so you either help me or you don't. And I was like, okay, all right, I'll have a look at it. And she had a flashback the moment I had her wired up to the EEG. And so that's how that started, that whole line of how else can this technology be used to help other people?
Mm-hmm. The current version of Sana is much like a VR headset almost, in terms that you kind of, you wear it over your eyes, and then it has the light pulses, and then there's that algorithm behind that kind of learns your patterns and then connects with the app. And then it learns over time how you receive that information, and then kind of takes the data from your body and then allows you to go into these states of deep sleep or relaxation or meditation faster. I'm interested in, you had mentioned the first version of this, and you actually worked with a gentleman named Bertrand Piccard, who flew one of the 24, the nonstop round the world flight, and used your device to put him into a state of sleep where he could only sleep in like 20-minute intervals because it actually had to be touched by human controls every 20 minutes. Can you talk a little bit more about that and how you used that flight as a test base for this? And then I listened to a funny interview with him where he was talking about you coming with this box and these wires, and he didn't really know what to expect, but he said, yeah, let's go. Let's try to do it.
Certainly. So the first version was two desktops, one wired up to a headset, the other wired up to an EEG. So that was me changing everything in real time. Then it became laptops because I was like, hey, I need to do this while I'm lying in bed, and so I can use it to put myself to sleep. And that was in the first few months that it became laptops. It stayed laptops, wires, and boxes all the way through to Bertrand Piccard. And I'll come to that back in a second. And the current version is kind of a step back from that, in that it's a wearable, so anybody can use it anywhere. We are measuring heart rate variability on the forehead as a proxy for EEG. We aren't yet putting that into a closed loop feedback system. That's in the next generation. It'll hopefully be the middle of next year. But yeah, so now it's down to a standard set of signals that we are putting through pivotal clinical trials to get FDA approval. So currently, we are focused on the sleep and wellness in terms of what we're actually approved for. We have a 513G designation, which says the FDA says, you're safe to go sell for a wellness indication. And we are now going through clinical trials to prove out the efficacy in all of the other areas that we've touched on. And so in many ways, the current version is less capable than the laptops, bars, and boxes, but the next generation will bring back in a lot of that adapting to the individual without me having to be there, which will actually be eventually what I always wanted to build but couldn't in the time in between. So 93 laptops, bars, and boxes. The Bertrand Piccard thing came about because Richard Branson, when he was flying around the world by balloon, had used the device to put himself to sleep on the balloon. Now, in a balloon, you've got you don't care about weight. Weight's not a problem. You've got a massive can that is extremely heavy, and adding an extra laptop on top of that was not a problem. Getting Richard Branson to use a laptop, that was a problem. He gave me a lot of shit for making fun of me for making him use a laptop the first time. But yeah, so he used it in that context. He was flying over, I think, Turkey when he got ill. The ground crew said, "You're now using that device, or you're landing." And he then used it, slept for 16 hours, and so they didn't have to land the balloon because he was better. And the only reason why that flight didn't get all the way around the world is because China made him fly around Tibet. And flying horizontally on a balloon uses up too much fuel. But that then led to Bertrand Piccard asking me to come see him about sleep. And so I turned up in Lausanne with my laptops, wires, and boxes, because that's where Bertrand Piccard was based. I put him to sleep in the meeting with the device, not boring him. I've done that, I'm sure.
While you were talking to him?
Yeah, I'm sure I've done that with VCs. But yeah, putting on a headset and getting someone to go to sleep in a meeting is a good party trick. It works to get people's attention. But he took it off thinking that he'd been asleep for maybe 30 seconds. And his assistant had come in and laid out all of this lunch on the table in front of us. And he's looking at it like, how did that get there? Oh, I must have been asleep longer. And I'm like, yeah, I let you sleep because you clearly need it. And he's like, great, but I'm not going to try and do his Swiss French accent. But he said, great, but I can't take something that's heavy in there, so you've got to now make this the weight of a cell phone, and you've got 5 weeks to do it. And that moment was the time when I immediately had the ability to go and borrow money from friends and family on the basis of, there's a real opportunity here now that's really time sensitive. So let me borrow money. I'll pay you back if I have to sell my house to do it, but just lend me the money. Let me go make this thing. So that's what happened. I flew off to Silicon Valley. I had a medical device mentor from business school who has said to me over the years, when you're ready to build the next prototype, come see me. I went to go see him. He drew up some circuit boards, some circuit diagrams, and was like, "Yep, okay, I can do this, but minimum 12 weeks." And I'm like, "I've got 5." And his response
gonna have to move faster.
Yeah, his response was, "Well, good luck with that, because I don't know how to cut any more corners. I'm already telling you I'm cutting with 12 weeks. I really want to help you, but I can't. So, come back when I can help you." So I went back to my motel room in Silicon Valley that night thinking, "Oh crap, what do I do now?" And I rang up a former friend in the UK, and I said to him, "I don't even know what the kind of engineers I need are. What are they called?" He said, "Well, you need a firmware engineer, you need a software engineer, you need a hardware engineer, you need a mechanical engineer." And
like every engineer, just give me every engineer.
Yeah. And I'm like, okay, where do I find those people? And he said, "Well, you're in Silicon Valley, right?" And I'm like, "Yeah." And he's like, "Okay, well, there are these places that are called the tech spaces, and they're basically like gyms where every instrument and machine that any engineer could want are all in one place, and they go there for their hobbies. And if you go hang out there, you might find some of these hobbyist people. I'm like, great, okay. So I immediately looked it up.
So just go hang out in this place and hope I find you.
Yeah, and there was one 10 minutes taxi ride away from me. So I got in a taxi straight down there, and the people at the front desk were like, okay, if you put something on an electronic bulletin board, then maybe someone will get back to you. And I was like, yeah, that doesn't really work for me, because if I can't get this done in 5 weeks, I lost this opportunity and I borrowed this money and I've got to make it work. And my next stop will be to try and fly off to China or something, because I had one engineer friend in China who said, if you can't do it in Silicon Valley, come here and I'll get it done for you. And I said to them, hey, would you let me hang out in your lobby while I draft this bulletin board thing, and then you can tell me if it's a reasonable bulletin board. And I used that as an excuse to sit in the lobby and harass everybody coming into the building. And there was
what did
one
you say to these people?
I said, I've got this really cool project which I need to do really quickly. Anybody can help me with it. And there was this one guy who said, well, I'm kind of semi-retired and I'm supposed to start this new job on Monday, but this sounds much more interesting. Let me talk to my wife and I'll get back to you. And he rang me back at 11:30 at night and said, okay, I found a software engineer, I found a firmware engineer, I'm the mechanical engineer, and I found one other person to complete the team. Can you meet us at 8 a.m. in the morning back in the tech space? I'm like, sure. So off we went. They sat there. They told me that they sat me down and said, okay, we think we can do this in your time frame but we're all going to have to drop everything we're doing just to do this. And I'm like, okay. And they're like, and you're going to have to pay us up front. You're going to have to pay us by the hour. And looking back, what they charged me was nothing. At the time, it was every penny I had, and I was like, "Oh crap!"
Everything you
raised. Yeah, and it was, and they worked round the clock to get the first prototype, which was basically we bought a sleeping mask, and the other bit of it was Bertrand Piccard said he needs to be able to open his eyes and see the instrument panel straight away, and so we had to build those two versions of the device straight away. And I couldn't figure out how we were going to get that done until I saw my first Google Glass. And I was like, oh, that's the form factor we need. That's what a pilot can wear, that he can immediately open his eyes and see his instrument panels. So I went onto Craigslist and eBay buying every broken Google Glass I could lay my hands on. And we literally used Google Glass frames. We 3D printed two side pods instead of it just projecting into one eye. We had the signal going into both eyes. Google never got upset about it. I'm sure if any of the engineers who were involved in making it, they would have been intrigued by someone using it for that. But they'd worked out the perfect form factor. They'd spent tens of millions of dollars making that form factor as good as it could possibly be, and we were just able to borrow it temporarily, shall we say. But yeah, they worked night and day, and the very first working version of that standalone thing that didn't need a laptop was ready the morning I had to fly to Abu Dhabi. I literally went straight from the tech shop all the way to the airport to Abu Dhabi, and I got into the Uber in San Jose, and I had to go to SFO, to San Francisco International, and then I was stuck in traffic, and I was like, kidding me, really? Like, after all of this, I'm going to miss my flight because of, and I'm not going to make it. And then I was like, hang on a minute, why am I getting stressed? He's either going to get there or he's not. And I've got a device that is designed to put me to sleep. And so I just said to the Uber driver, okay, wake me up when we get to SFO. And he looked at me like, what?
That's your field test. Now we got to field test this thing in the Uber on the way to the airport.
It was literally the first time that standalone device had been used to actually put someone to sleep, because we hadn't been able to take it out of the tech shop. And so I just lay there fast asleep, because one thing is, if you're tired and wired and then you use the device, it really works to put you to sleep really fast. Tired and wired is the easiest thing to put someone to sleep from. And then, he woke me up when we got to SFO, got on the plane, flew straight to Abu Dhabi, which is where Bertrand Piccard took off from. we had about a week there while he was prepping, and we had to get the FAA to agree that the device wasn't going to be dangerous if it was taken on the plane. And then, and that was the restart of the company, because all the time between all that early work with laptops, wires, and boxes through to 2000, I couldn't use it what I really wanted to, which was everything to do with pain and sleep and mental health, because I couldn't put it in a position where people could use it every day, multiple times a day, whenever they wanted to. And wearable technology just wasn't a thing. And then that all happened at the beginning of 2015, which coincided with how wearable was really catching up with where we wanted to. It's still not quite there, and the sensor we've got in the device currently is the best we could get on a wearable device. Still not good enough to do the closed loop feedback system, which is why we developed a new sensor to create that final closed loop feedback system. So basically, next year, I'll finally have exactly what I wanted to build all the time since I first admitted that it affects me.
So close to 30 years.
Yeah. So stubborn. Stubbornness. I'm not sure if that's resiliency. That's stubbornness.
I think it's drive and persistence.
I mean, lots of people ask me, like, how did you keep going on that? And it's really simple. It's every single time I met someone who I thought, I should be able to help you because what I've done can potentially help you. I just felt like a total loser. And I was like, okay, well, I have this thing that could help this person and I can't. And it's really, really irritated me. And so that was the drive. It was like it was knowing that every single time that I met someone that I should be, the technology should be able to help, couldn't. And that was really the drive. I mean, the first drive was do this or die. And then the getting it out to other people was like every single time. It's like, because the neuropsychiatric drugs that are out there, they really don't work. There's none that will really work well. They all have side effects. They all have issues. They're all the work of immensely just decades and decades of people working really hard to produce the best thing they possibly could. But the drug route just has a problem in that the brain has so many interconnected feedback loops that you can't affect one thing in the brain without affecting multiple other things. And that's the limit of neuropsychiatric pharma. So really it's seeing that need and going, okay, well, we potentially have something that could be a really useful addition to everyone's toolkit.
Let's dig into that a little bit more, because when you talk about sauna and you talk about the effects of the device, you speak in terms of both the wellness benefits and the pain relief. We've talked about clearing the busy mind, supporting enhanced relaxation, improving sleep management, reducing feelings of stress, and enhancing recovery from fatigue. I want to read a testimonial from a patient on this because I think it really ties this together, and this concept that your pain that you're in actually then leads to all of these other secondary conditions. And those secondary conditions are what take you over emotionally. So there's this physical aspect, but then because of it, you now begin to degrade mentally and physically because of that pain. So the testimonial from the patient reads, when you live with conditions like fibromyalgia or lupus, or struggle with the pain of rheumatoid arthritis or spinal stenosis like I do, the pain can often be accompanied by brain fog, blurry vision, frustration, depression, and anxiety. In my experience, this can all contribute to a feeling of deep disorientation and disconnection inside your body. Can you talk a little bit more about the interconnectedness of the physical pain with the mental and emotional wellness? And you experience that yourself. You've seen that in others. And now how is sauna, it's breaking that down essentially at this point.
Yeah. So essentially, if you think about pain, anxiety, and sleep, just those three, the more pain you're in, the more it's going to damage your sleep. And once you damage your sleep, you're damaging everything. And you've got to break that cycle somewhere. So my own personal experience at the start was, I'm lowering my pain while I'm sitting at my desktop with my two desktops. And then I'm lying down to try and go to sleep. And I'm re-aggravating the damaged nerves, which is then stopping me sleep. And then I'm in more pain. I'm in as much pain as I was when I wake up. So for me, it started with that. Okay, well, can I do this while I'm lying down to help me go to sleep better as well? And that's what really started the cycle improving. And fibromyalgia is a good example. So that the average person on fibromyalgia is taking 5 to 8 different drugs to deal with the different problems that they have. So drug for anxiety, drug for depression, drug for sleep, drug for pain, and on the list goes. And all of these things then have side effects that then build off each other. And all the way through, you're getting more into the fight flight, not less. You're solving one problem with creating more problems in another area. So really what we're trying to do with the device, and the clinical trials will prove out whether you've actually cracked it or not, is to break that cycle, give people stress and anxiety relief on demand, allow people to sleep better, and then to allow everything else that is being done in their medical care to work better. So that's kind of where we're going for. So there is almost no pain that doesn't have a central mediation component, i.e., the processing of the signal that goes on in the brain. The more stressed or anxious you are, or the less sleep you have, the more pain you feel for any given signal that's coming up from your body. So we want to help in every area that we can possibly help with on that. It's the same within mental health. There's almost no area of mental health that isn't made worse by sleep problems and stress and anxiety. And so likewise, we want to help in those areas too. There will be some areas and some people like me where we are the solution. They don't need that much else, but those are going to be the rare ones. The vast majority of stuff is we're going to be a really, hopefully, useful tool in the toolkit to help people figure out what other things are working for them and what aren't. One of the real mistakes I made in the very early time was believing that there would be a silver bullet. And that's what really the drug mentality is. It's okay, where's the pill that I can pop that's going to solve my problem? The human body and the human brain really don't work like that. And there's whole fields of integrative, or what's now being called more often root cause medicine, where the entire emphasis is in the holistic approach to solving these problems. You're striving to be the bit in there that is, let's help people sleep better, let's lower anxiety, and let's see what are the problems we can help solve. So in my ideal world, in 5 years' time, if you go to a primary physician and you've got a pain problem or a mental health problem, and that doctor goes, okay, this person, their problems are being made worse by sleep problems and anxiety problems, let's help them with that and then see what that does to everything else they've got, and then I'll add in the next thing. That's where we want to end up. We want to end up with helping solve lots of different problems by being the sort of rescue med, as it were, for anxiety and sleep problems.
Well, you're attacking the root cause versus the symptoms, right? And the symptoms are what is being masked by the opioids and by the prescription drugs. And I think this is really interesting because the CDC says that the number they put on it is that there's about 130 Americans die every day due to overdose of opioids. But sauna is non-narcotic. It's non-addictive. We've had conversations about this in other episodes. We spoke with Dr. Chris Free about what he termed operator syndrome. And that's where you operate at this enhanced rate all the time. You push yourself too far, too long, to the extreme. You never take time to rest. But his theory is that you have to find ways to build in wellness. You have to be able to sleep. You have to have increased and improved nutrition. You have to have mindfulness. And you can do that without narcotics, without drugs. In a couple of weeks, we're going to speak with General Peter Corelli about TBI, PTSD, and wearables that are being introduced to treat specifically TBI and PTSD as replacements for narcotics and prescription drugs. But there's also a cost component of this. Prescription drugs are expensive. I mean, there's a lot of these major pharmaceutical companies make a tremendous amount of money off of prescription drugs. And because you become addicted, because you're just masking the pain and you're not treating the root cause of the pain, you're consistently having to go back to buy more drugs. They're expensive if you have insurance. If you don't have insurance, I mean, it bankrupts you if you really do need these things and you become addicted to them. Sauna's $450. So I'm interested in your thoughts on that.
Okay, first bit, yeah. On our pricing, we are going out with a subscription model, and on that's at the moment is $100 a month, and over time, hopefully, we're going to be able to get that down. But we can come back to that. But there are some drugs that I just would be happy if they went away, because I can't see how they how we're just not a better option. Top of that list would be Ambien. And there are other things like opioids where they have their place. And what we've seen in some of the longer term follow-ups and trials is people dropping opioid consumption and across all painkillers about 30%. And so the ideal is that people end up being able to use the correct tool for the thing at hand. So if you're in a lot of pain and you don't care about being able to drive or work or spend time with your family for the next 4 or 5 hours, a heavy duty opioid narcotic might well be the best tool for you to use in that time frame. And if you do want to do those things, then you might want to opt for less pain relief but more cognition and more ability to do stuff. Then you're going to go for a device use. And if you cut down opioid use by about 30%, you probably cut down the risk of those opioids by more like 60%. So each incremental bit that you take off, you are then lowering people's other risks. We don't know exactly what those numbers are, but I've heard numbers like that talked about with opioids. So with opioids as an example, the aim isn't let's get rid of opioids. The aim is let's add another option into the toolbox so people can use a less risky alternative when it is appropriate. On the PTSD side, as I told you, it was the first 2 people or 4 people I helped other than myself, and that's always been really close to my heart. We got awarded our first DoD grant last couple of weeks to run the first part of a PTSD study. We will be picking up TBI data in that PTSD study. And then as soon as we have the data from that, I'm very much hoping the data is going to be good enough that we are then able to go and get the funding to go and do a larger study in those 2 areas.
On the studies, because I'm very interested in the studies as well. So you're conducting the clinical trials now for FDA approval for fibromyalgia and neuropathic pain. You received the designation, as you mentioned, for the breakthrough device in April earlier this year in 2021. You've completed 2 studies so far, one on fibromyalgia, one on opioid dependency. And the results have been very good. That there was the perception of pain, and the fibromyalgia results were that the perception of pain was reduced by 20% and then anxiety by 36%. And then 84% of participants had a reduction in pain, and 85% of participants chose to continue using the device after the study. The numbers in the opioid results are somewhat similar. So I'm interested in what exactly is the breakthrough device designation? What does it allow you to do? And what does it not allow you to do?
Yeah, very good question. So the breakthrough designation is for fibromyalgia. And it basically is the FDA saying your pilot's data is interesting enough and fibromyalgia is a big enough and serious enough problem that we're going to give you breakthrough status, and that affords faster track through the FDA to get full approval. And what's a bit of a political hot potato at the moment in Washington, a faster route to reimbursement. The reimbursement piece, CMS is currently evaluating how they're going to implement this or an alternative to it. But either way, it probably still means that we will end up getting reimbursement a lot sooner than we would have done without it. So it is speeded up review by the FDA once we have completed the pivotal trial. So hopefully faster route to helping people, and then also faster route to reimbursement. So really, breakthrough status is about helping people like us developing technologies in areas that are helping either save lives or radically improve lives where there aren't good alternatives to get to help people faster.
In addition to the 2 studies that have already been completed, what's next?
So the 2 studies that are completed have been pilots to give us data to figure out what the next ones are to do. So fibromyalgia is the one that we're targeting first to get through the FDA. So the pivotal study on that is really important. The next one to complete should be neuropathic pain, and that's with Mount Sinai. Then it'll be anxiety, which we are doing with the Mighty. And the Mighty is a 2.5 million strong patient advocacy group. And we are also doing with them a 1,000-person one-arm fibromyalgia study, which should end up being the largest non-drug fibromyalgia study ever done, to help us figure out where within fibromyalgia we can most help. And then the next one after that to complete should be PTSD, which we've just won a DoD grant for to do the first 40 people with PTSD.
Richard, as we close out, I ask every guest the 3 things that they do to be successful every day. And this is important because in World War II, the Jedburghs had to do 3 things with the utmost competence every day to set the foundation for them to focus their efforts on other challenges. Those 3 foundations were they had to be able to shoot, they had to be able to move, and they had to be able to communicate. What are the 3 things that you do every day to set the conditions for success?
I'm not going to do these in the right order necessarily. I'm going to start with the end of the day.
Okay. This is the first time somebody started with the end of the day. Actually, everybody always starts at the beginning of the day.
Well, it's in terms of what I do slightly differently, it's probably the most important one. And that is diary or journal. And I start every journal entry by writing, I am grateful for, and then whatever it is. And so I kind of write a mixture between a diary and a journal, and I try to think through all the people that have helped me during that day. I mean, there's no way that we get to any of the people that we're trying to help with Sana without an incredible team. So the number of times I am grateful for, the first thing I write in my diary in the evening ends up being my team or specific members of my team or some of the really awesome helpers and advisors. They're just giving us lots and lots of their time and effort to help us move forward. Doing that every day, consciously in your head, going, okay, this is what went well, this is what went well, this is what went well. That is a massive boost against all the slings and arrows of outrageous fortune that come your way that screw things up. Because however bad a day is, I can guarantee anybody can find one thing or one person that did something to help them that day. And yeah, when you do that as well, I think it really, and especially on the good days, because on the good days, you really realize as well that those are also driven by all the people that are helping you. And anybody who's doing anything useful at all, I can guarantee has got reams of people that are helping them in small ways or large ways. And it really helps focus on that. And then sort of within that sort of diary thing, the other bit I do, which is a bit geeky, is at the end of the day, I put a happiness score on it. And then I put a one line of what made it that. So if it was a 5, what made it that? If it was a 9 out of 10 on a happiness scale, what made it that? And if you do that day after day, week after week, month after month, it really helps you realize certain things like external factors have very little to do with your internal mental state, because they don't change a lot, and your mental changes hugely from day to day. So that's the diary writing thing, because it really gets you to be aware of what is making you happy, what's making you productive, what's not. So that whole sort of diary thing, massive, massive piece right there. And if that's probably something I do slightly differently from other people, but strongly advise people to do that one.
Yeah, that happiness score is incredibly insightful, and actually that's something that I think is important that we should talk about more with more people, because we often think about reflection, and we've had a lot of guests who've talked about meditation and spending a few minutes a day kind of looking inwards, trying to identify what's driving them. What do they truly want? We've had tremendous amount of conversations about identifying your authentic self and trying to find out what drives you to happiness, and then focus on those things in your life and cut out the other stuff. We haven't had it quantified in this way with a score and a reason. And I find that incredibly just insightful and an amazing way to kind of tie that up at the end of the day, and then build that over time where you can actually then look back and see the path. And are you making progress to where you want to be? I'm going to take that from you. I'm going to talk a lot about that in future episodes. I know it.
Yeah. I mean, so the reason why it happened was because I was reading the Dalai Lama's Art of Happiness while I was doing my stint at McKinsey. And McKinsey sort of, if they had a mantra, it would be what doesn't get measured doesn't get done. And the Dalai Lama there's a talk about 45 minutes a day being the minimum he spends every day analyzing how his day went. And I used to do a painkiller score when I was dealing with, when I was going through my worst of my pain, and a happiness score. And that just making day after day, week after week, month after month, realizing that, the number of painkillers I took was what was changing my level of happiness, not my external reality at all. So yeah, it became a habit. I don't take painkillers anymore. I don't have to more than, I probably take like 3 or 4 lots of acetaminophen a week, if that. So not enough to note in a diary, but yeah, whatever your main goal is in life, and you should be putting a score on it each day. And happiness just is a really useful one. So yeah, that's how that happened, and it's helped me of the things I do for myself. Other than building a team around you is definitely the most important thing of getting stuff done. But of internal stuff, I'd say that was number one.
Wow. All right, I'm ready for 2.
Okay, I'm gonna go for a cheesy one that lots of people I'm sure have told you. Make your bed. The very first thing in the morning.
It's important, though.
It's really simple. It gives you a little bit of feeling of control over your life. It's that simple. And it does make it feel more like something you want to get into at the end of the day if you made it at the beginning. It's cheesy, but it's true. And then the other thing is the number 3 is, once you've identified the things in your life that bring you the most joy, you just have to have a bit of that every day. For me, it's the number one thing is my 5-year-old. And so he just makes me smile whenever I, so even when he's not with me, doing that little bit of story time with him on FaceTime becomes, you've got to do your thing each day that is not related to work at all, that just makes you smile and makes you happy because of what it is. And if you're not doing that, then what are you living for? Like it's you got to self-care. There was a moment when I was flying on a plane to Brazil, and I was in the very front row, and the air steward got up, the air attendant got up and did the whole spiel about gas mask, your face masks and everything else, and he was acting, just camping everything up to the absolute max, and just being dramatic and funny, and he was giving it seriously to the people in front of me. And then he just leaned to me and go, "If you're so stupid that you don't understand this point, then you do deserve to die." And it was just like, it was that big like aha moment, because on my business at the time, I had been running around trying to help everyone else and not putting my own gas mask on first. And my kid is that bit of self-care that's the most important bit of self-care. That's what makes me laugh or smile guaranteed in a day. So Everyone should know what that thing is in their life, whatever it is, and make sure they do that some of the day, regardless, every day.
I think that your three have been easily three of the best that we've ever talked about on this podcast.
Well, thank you. I appreciate that.
I mean, really, really, truly thoughtful in a sense of you just understand the things that drive you, and you understand yourself to a level that a lot of people, they don't. And I think that that's a testament to what you've been through. And I think it's a testament to what you've overcome. We talk about the 9 characteristics of elite performance in every episode: drive, resiliency, adaptability, humility, integrity, effective intelligence, team ability, curiosity, and emotional strength. We referenced a lot in this episode your resiliency and your adaptability. And we always say that elite performance requires a combination of these 9. Elite performers have all 9 of these characteristics, but depending on the situation they're in, they'll exhibit different versions of each of these. I say that, and then I always apply one to my guest. For you, when I think about you, it is this resiliency, it's this adaptability. After our conversation here, it's also this drive. And so I normally don't give more than one, but I've got to give you these 3 because there's the drive to just never quit, to find an answer, to push forward, to make things happen. There's the resiliency of this perseverance in the face of challenges, and you have faced the utmost challenge. And there's adaptability to adjust your behavior to the situation, to figure it out. You have faced some of the most consequential challenges that anybody can face in their life, and you did it at a young age. And you exhibit elite performance when you look at the face of those challenges and you say, this doesn't matter. I'm going to figure it out. I'm going to succeed in this life, in this world. It's an inspiration to hear your story. It's an inspiration to see what you're doing with Sana, to understand where it's come over 30 years of pushing this thing forward and see it, that having the effect that it has on you, on others, and to see where this is going to go over the course of the next 5 years, 10 years, and even further. Thank you for joining me here today. I've really enjoyed talking to you and telling this story, and I look forward to watching Sana and you as you move through clinical trials and field this thing to the masses.
Well, Fran, I really appreciate that. Thank you very much indeed. I always feel a little bit of, not exactly a fraud when someone says those things, but privileged. That's a better word, because there's a lot of the things that you talked about, which I got because I had a family background that wasn't always easy, but I had that basis of stability and I had that safety net that I still have, that everyone I see around me has to some degree. And I'm always aware of the privilege that is. I'm able to keep going because ultimately I know I could screw up as much as I wanted to, and I'm not going to starve. I could still, I could still go and have a bed at my dad's place. And that stops me ever thinking that any of us do any of this stuff alone. We do it because we're able to do it because of the people around us. We're able to do it because of our families. We're able to do it because of our teams. We're able to do it because the other people that share the same needs, the same desires, and the same aims in the world. So I just feel immensely privileged. So I really appreciate your words, and I want to just say thank you to everyone in my team, in my extended team, and my extended family for helping us get to where we've got to, and you for giving us a platform, because without people hearing our story and what we're doing, we can't grow either. So a huge thank you to you too.
It's an important message. I look forward to it. Thank you.
Thank you.
American Jedburghs went on to form the foundation of the United States Special Forces and the Special Activities Directorate of the Central Intelligence Agency. Thanks for listening to the Jedburgh Podcast. I'm your host, Fran Racioppi. We're brought to you by the Talent War Group, an executive search firm and talent advisory. We'll drive you to attract, retain, and develop top talent. With services like talent acquisition, leadership development, and keynote speeches, we work with you to create talent solutions to business problems. To get started, visit talentwargroup.com. Join us next week for a new episode of the Jedburgh podcast on Spotify, Apple, Stitcher, and iHeartRadio, or wherever you get your podcasts. If you like what you heard, give us a like and leave a review. Follow me, Fran Racioppi, the Talent War Group, and the Jedburgh podcast on LinkedIn, Facebook, Twitter, or Instagram, and send your comments and inquiries to media@talentwargroup.com. As former members of Special Operations Forces, the Jedburgh podcast and the Talent War Group contribute a percentage of all profits to the Special Operations Warrior Foundation, supporting the families of our fallen warriors. Thanks for joining us on this episode. How you prepare today determines success tomorrow.